This module will review postoperative instructions after total hip replacement. If you are going home on the same day as your surgery, your coach or support person will drive you home and be with you overnight. You can be up walking with assistance, going to the bathroom, and doing stairs as instructed by the therapist. Be safe, take it easy, and pace yourself. Stay well hydrated and be careful to change positions from lying to sitting to standing slowly. Start the pain management as instructed by the discharge nurse. On postoperative day number 1, your dressing will remain in place and there is no wound care that needs to be done. Pace yourself, stay well hydrated and nourished. You will be seen by a home therapist who will help assure that you acquire excellent range of motion, strength, and function. Continue with your schedule of medications. Start the aspirin today. Most patients will take 325 milligrams twice daily. In some patients with a history of GI or kidney problems, we may suggest taking 81 milligrams once or twice daily. Also start a constipation regimen to include Colace, 100 milligrams twice daily, and Miralax, 1 tablespoon mixed with a cup of water once or twice daily. On postoperative day number 2, your dressing will be removed today and you can leave your incision open to the air. You will be given dressings to place over the incision when you shower. Your incision should be covered with dressings for 10 days while showering. Continue with the home exercise, pain management, and swelling control regimens. If you find that your legs are swelling, elevate them above your heart with pillows. We will review this shortly. For postoperative days 3 through 7 and beyond, continue with the medication regimen. You may taper off the stronger pain medications when you no longer need them. See our video on pain management for further instructions on this. You should continue the aspirin for 30 days. Continue home exercises and swelling control. Continue with good hydration and nutrition, and try to resume as much of a normal sleep cycle as possible, and nap if you feel tired. Your care team will provide a schedule for pain medications to take after surgery. This will take into account any allergies, intolerances, or potential medication interactions. Staying ahead of the pain is paramount to achieving your rehabilitation goals, and our multimodal program is designed to be taken on a schedule. We will arrange a visiting nurse and therapist for the first 1 to 2 weeks after surgery. This person will check your vital signs, assess your surgical site, and overall well-being. They will also work on home exercises and swelling control. This provider can communicate any concerns to your care team. Your incision will be closed with absorbable stitches and covered with steri strips or skin glue. There will be a dressing over the incision that can stay on for 2 days if dry. You will be given additional dressings to cover the wound when you shower for the first 10 days. Remove these after the shower and then leave the wound open to air. Try to keep your incision clean and use good hand hygiene. It is normal to have some swelling and bruising around this area early on. You may see some bruising track down your leg. This is normal. If you notice any drainage from the wound that persists for more than 2 to 3 days, please contact our office for further instructions. We'll now talk about swelling control. Active swelling control is important immediately after surgery and on a regular schedule. Ice and elevation, putting your toes above your nose, are the best methods of swelling control. These should be performed several times a day for the first 1 to 2 weeks. Ice should be applied to the hip 20 to 30 minutes at a time several times daily. Place a cloth between the ice and skin to avoid frostbite. We recommend making ice bags with 1-gallon Ziploc freezer bags, 1 cup of rubbing alcohol, and 3 cups of water. Make 3 to 4 bags so that they can be exchanged when thawed. Elevation requires that you get your legs above your heart. Elevating both legs is important as both legs can swell after surgery. Use several large pillows and set this up in advance of surgery, as shown in the picture below. We will now review hip precautions. Hip replacements can dislocate early if patients twist them into the wrong position. The therapist will review what we call hip precautions, which are things to avoid for the first 8 weeks. These are not permanent restrictions, but positions to avoid during the soft tissue healing phase to prevent a dislocation. If you wish to sleep on your side, it is best to keep a pillow between your legs at night for the first 6 weeks. The picture below demonstrates general guidelines for avoiding dislocation. Positions of risk include bending forward past 90 degrees, crossing your legs, twisting your toes inward, and turning your knees inward together. These are best viewed on the picture so that you can see specifically what motions to avoid for the first several weeks after surgery to prevent a dislocation. Daily exercise is important after joint replacement to improve strength and motion. This does not happen automatically but takes motivation and grit. The therapist will review home exercises which you can perform a few times daily. You may increase your walking as tolerated. Try to avoid any impact activities, squatting, or activities that involve pivoting or twisting for at least 6 weeks. Outpatient physical therapy will usually start 1 to 2 weeks after surgery. Depending on which side you had replaced and how your recovery is proceeding, you should expect to arrange transportation for the first few weeks. Consult with your care team about where you plan to attend outpatient therapy, as our office does recommend certain practices who are most familiar with our protocols and goals. Most patients will attend outpatient therapy for 8 to 12 weeks after surgery to maximize range and strength. Maintenance exercises are also important. Since you will only be attending outpatient therapy 2 to 3 days per week, it is essential that you perform daily exercises on the other days. Full recovery from hip replacement can take up to a year as the healing process matures and patients continue to make gains in motion and strength. We highly recommend that our patients continue a maintenance exercise program that continues beyond the end of formal physical therapy. In terms of follow-up, we see patients back at 3 weeks, 3 months, and 1 year. If you have any problems with wound healing, such as persistent drainage, redness, open areas, or increased pain, we may ask you to come in for an evaluation. You should expect that it may take 8 to 12 weeks before you start feeling closer to normal in terms of walking cadence and stamina. In terms of return to activities, it is important to allow sufficient healing before anything strenuous. In general, you should wait 8 to 12 weeks before engaging in strenuous exercise to avoid injury to the soft tissues around the hip. The early focus should be on maximizing range of motion, while strengthening should be a controlled and gradual progression. Walking and biking are good early low-stress exercises. Hiking, skiing, racket sports, or anything that requires significant joint loading, impact, or agility all require that patients are well healed and rehabilitated. Check with your care team about return to such activities.